So good morning, everybody. Welcome to the 13th of June. Welcome to our spring Zoomcast seminar. So great to see so many people on the call. I want to remind everybody, if you've got your, if you're on, please put your camera on so we can see you. We greatly appreciate that. Lots of familiar faces in the house today, so thank you very much for joining us. My name is Robert Crowder. I'm the president and founder of the Benefits Trust, and we're excited that you're here today. On behalf of all of us at the Benefits Trust, we want to thank you for the time that you're spending with us today. We're going to talk about healthcare spending accounts today and the ins and outs, but we'll get into that in a moment. But just really on behalf of all of us, want to thank you for your time. Joining us today from the Benefits Trust, Carrie Lane. Give us a wave, Carrie. There's Carrie. Mike Ignatz is here in the house as well. And Robert Crowder, my son, is in the house as well with us, joining us today. They're going to be monitoring the chat box. So if you have any questions, thoughts, ideas, make sure you put it in the chat box for everybody to see, or privately, it's up to you. And they'll be able to answer any questions that you have throughout the day, throughout the presentation this morning. We're going to end right at 11. We might stick around for a couple of hours, no, God, no, a couple of minutes after after 11 Eastern time. I know Chelsea, I think, is with us from BC. But we're going to be sticking around for a few minutes after if you want to have carry on the conversation or have some specific questions. We'd certainly love to chat with you about those. I just want to remind everybody as well that for participating today, you're going to get a CE credit. I know some of you have participated in other sessions that we've done in the spring session. And Mike Ignatz, Mike, just out of curiosity, when are we going to be sending out credits?
The first ones will go out today.
First ones are going to go out today, so we're going to be getting caught up on those credits, and the credits for today's session will be coming out in the next week or so. As well as that, you're going to get your CE credit. You're going to get a survey. Fill out the survey, send it back to us. It takes a moment's time. Send it back to us. For example, this session today about a deep dive into healthcare spending accounts came out of feedback that we received from you. So please send back the survey. As well as that, if you're not already signed up for it, you will be signed up for our Trusted Advisor newsletter. We invite you to visit thebenefitstrust.com. You can see where we've got future Zoomcasts on there. And again, I want to remind everybody to put your cameras on if you could. That would be great. I'm going to take a moment to share my screen, and let's get started. Everybody can see that, I'm assuming, and let me press play. Awesome. Everybody can see that?
Yep, looks good.
Perfect. So a deep dive into healthcare spending accounts. A deep dive into healthcare. Let me just move my cursor. There we go. A deep dive into healthcare spending accounts. That's what we're going to talk about today. And again, this came from feedback directly from you from past webinars and seminars that we've done. So again, please fill out that survey. So we're going to talk today. Oh, a second. Why isn't this working? There we go. Okay. Agenda. What we want to talk about today is client needs analysis. Who can benefit from a healthcare spending account? What is a healthcare spending account? We want to talk about risk analysis and where and when do you use a healthcare spending account? Tax considerations of healthcare spending accounts. We want to talk about reporting and accounting considerations and why we use healthcare spending accounts and why they're becoming more popular. We want to review a couple of case studies and then, of course, have some time for questions, answers, and discussions. Again, if you've got a question, you got a thought, you got an idea, throw it in the chat box, raise your hand, use the emoji on your Zoomcast screen, and we'd be happy to hear your point of view. As simple as that. We're pretty excited about healthcare spending accounts because we've had a lot of discussions about the healthcare spending accounts. But if we look at the Ontario marketplace, and I know we've got a couple of people from outside of Ontario here, but really we're just focused here in Ontario at the moment. When I was putting this together, at least. And we look at Ontario right now, and there's 449,000 businesses, almost 450,000 businesses in Ontario at the time that I put this presentation together. A couple of keystrokes, I found that out. And it's amazing. There are 440,000 businesses that have less than 100 full-time employees. So it's amazing when you think about it. Canada is really made up of, and Ontario specifically is certainly made up of smaller business. However you want to define small business. I don't like to say small business because I hate when someone calls our business a small business. I like to say we're a profitable business with few employees, right? It's as simple as that. But 440,000 of those businesses have less than 100 full-time employees. And as well as that, there are more cranes in Toronto right now. There are more cranes in the GTA right now than most US cities combined. There's more than New York City, Los Angeles, Washington, and San Francisco, right? It's amazing when you think about what's going on in Ontario right now, and Canada for that matter. You know, the economy's up, it's hot, it's crazy. There's 208 cranes in the GTA right now. 208 cranes. So this is without a doubt where the money is. Southern Central Ontario, same in the major metropolitan cities like Vancouver, Montreal, Halifax, etc. That's what's going on. I was at a wedding on the weekend and I was talking to some folks from Halifax and they were talking about how hot the economy is there. So we want to look at it through this lens. We want to look at this marketplace and healthcare spending accounts through this lens. And the real question that I have is how can you provide value? How can you provide value-added service as a professional advisor at a profit? The key thing is at a profit. It's easy to provide value-added service, but you got to make money at it. It's as simple as that. We're not charities. We got to make money at it. You have to make money and we have to make money and our clients have to make money. That's a good partnership. So the question is, how do we do it? We've got endless prospects on one side. How do we do it at a profit? And through this lens, we're going to explore. A little bit of a disclaimer. Benefits Trust started on January 1st, 1994. So we've been around for some time. I used to have hair back then. I know I've been dealing with Michael Lynx for many, many years. And Michael, you probably remember when I had hair, right? Yeah, he's just laughing now. Okay.
Definitely.
Yeah, we started on January 1st, 1994. Our target market list is we work with advisors with clients with less than 100 full-time employees. That's our target market. We work with advisors like you since April 1st, 2001. We do not sell direct. Again, we work with advisors like you. These are our views and our opinions. We're putting on this session. So these are our views and our opinions, and it's based on 10,000 meetings in this space. I think over my career of 30 plus years, I've had more than 10,000 meetings in this space talking to small business. And I hate to use the word small business or businesses, profitable businesses with less than 100 full-time employees. I've had probably 10,000 meetings in this space asking them to buy. This is about continuing education. It's not necessarily about the Benefits Trust. So this is not a commercial for the Benefits Trust. I'm going to tell you what it is that we do and how we use these applications, but it's really not about us. It's about you and learning and getting something of value out of this presentation. But one of the things that's really interesting is we've had more conversations about healthcare spending accounts in the last 5 years than the previous 20 years combined. So healthcare spending accounts are certainly something that is very topical today, without a doubt. So client needs analysis. I think before you even start talking about healthcare spending accounts, it's important to have an understanding of what a client needs analysis is. You got to know where your client is going to help best determine how you can help them, or quite frankly, even if you want to help them, you've got to know where your client is going. And the best way to know where they're going is to ask a question or ask questions. It's interesting. I was on a trip to Italy and I had a friend of ours who's a travel agent help us out with some of the arrangements. And, it's great because she was asking all of these questions. What do you want to do when you're in Italy? What do you all these types of things. She wanted to know where we were going and what our interests were. We have to do the same with clients. And the best question that I've ever heard, and I've been using it for more than a decade now, and it's really changed a lot of my life. It's gotten a lot easier, quite frankly. But it's quite simple. If we were meeting here, and this is a question that you can ask your client, you can ask your prospect, you can ask your clients and prospects over and over again. You can ask your friends. It's a great dinner party conversation, but it's just a fabulous question to find out where people are going in the future. And the question is simple. If we were meeting here 3 years from now and you were looking back over those 3 years, what has to have happened to say that those were the best 3 years of your life? It's an unbelievable question, and it's so powerful. And I often start off these presentations with this question because it's just such a powerful question. It's such a powerful question. But when we're talking to an actual client or a prospect about this, the answer is going to give you a very clear roadmap of where they're going to go. They're going to give you that roadmap. They're going to tell you if they're going to grow their business. They're going to tell you if they're going to sell their business. They're going to tell you if they're going to merge their business. They're going to tell you if they want to retire in the next couple of months or years. They want to tell you if they're going to enter into new markets. They're going to tell you if they're going to develop new products. They're going to tell you all sorts of things. And I remember asking this question a while ago of a particular client, particular prospect, pardon me, and I was with the advisor, and the client said very clearly, We want to be out of this business in 18 months. We are growing this business to sell it, and we want to be out of it in 18 months, right? We decided at that point in time that we did not want to engage and work with them. The advisor and myself decided at that point in time that we did not want to engage with these folks, because not that we didn't like where they were going, but it just didn't fit in with the advisor's business plan, and it certainly didn't fit in with our business plan. So it gives you a roadmap of where they're going, and if you and how you can help them. But if you don't like where they're going, there's again endless prospects with 440,000 businesses in southern and central Ontario with less than 100 employees. So it's a great question to ask right off the top. And if you don't like where they're going, like I always say, next. There's so many prospects, endless prospects. So client needs analysis, and we're talking about healthcare spending account. In a traditional employee benefit program, and I'm talking in generalities here, so don't get upset with me, but I'm talking in generalities here, right? In a typical employee benefit program with a traditional funding method and a traditional plan design, 20% of the population of that plan is going to drive 80% of the costs. Simple as that. 20% of the population is going to drive 80% of the costs. You're going to have a couple of people that are going to claim a lot and a couple of people that are going to claim nothing. And those 20% of that population is going to drive 80% of the costs. The opposite is true with respect to a healthcare spending account. If you had a traditional plan on one side of the spectrum and a healthcare spending account completely on the other side of the spectrum, right? Just a healthcare spending account, 80% of the population would get an increase in benefits and 20% of the population would be upset. So when we're talking about client needs analysis, it's important to understand where healthcare spending accounts fit using that 20/80 rule. And I like to translate things and keep things very simple. When you're talking to end user clients, they understand this. They get their head nodding up and down. They see this. So employees certainly understand it. Plan sponsors certainly understand it. But the thing to remember is a healthcare spending account, it's not either or. I still get this question, and it's amazing. I still get this question all the time. I want to have a healthcare spending account, but I don't want a traditional. It's not either or. A healthcare spending account is just part of an employee benefit plan. It's just part of an employee benefit plan, and how big of a part it is to be determined by the plan sponsor. It could be 100% of the plan, or it could be 5% of the plan, or 1% of the plan. But a healthcare spending account is really just part of an employee benefit program. So it's important to get that mindset and help your clients have that mindset. It's not either or. It's the healthcare spending account is just part of that plan. So what is a healthcare spending account? Well, a healthcare spending account is nothing more than, I like to say, a bucket of money. It's a bucket of money that you put in for each of your employees or each eligible employee. Plan sponsor, your business, puts the money in, and the eligible member gets to take the money out for reimbursement of eligible expenses. Eligible expenses as defined by Canada Revenue Agency. And the list is vast. And Mike, I know you were looking at this recently. Mike, how many pages are on the eligible list of the CRA expenses? It's pages and pages, isn't it?
Oh, I mean, yeah, it's exhaustive and it's exhausting to look through.
Yeah, it's exhaustive and exhausting to look through. A good way to put it. But there's, literally, I don't know how many eligible expenses, but right down to veterinarian services for your seeing eye dog, right? Or your service dog is an eligible expense under a healthcare spending account. So money goes in, money goes out. It's a bucket of money. No one else can touch your bucket. If Chris Gorey was an employee of mine and my business gave me $1,000 in my healthcare spending account and $1,000 in Chris's, that's for Chris to spend his $1,000 and it's for me to spend my $1,000. But the two buckets don't mix. Simple as that.
Thanks, Rob. Appreciate the money.
Appreciate the money. I love it. So when we think about healthcare spending accounts, it's just part of an employee benefit plan. And just like an employee benefit plan, the promise, an employee benefit promise, with respect to healthcare spending account, the promise is made annually in advance, right? So I'm going to say to an employee or a group of employees, everybody in this group of employees is going to get, for example, $1,000 in their healthcare spending account for this benefit year. That's a promise that the plan sponsor is making annually in advance. The plan sponsor determines the amount or formula to determine that amount that goes into that bucket. But the plan sponsor also has to make three or one of three very important decisions. And again, this can be done by class. But the plan sponsor can choose a balanced carry forward option. So if Chris, using that example, because I'm picking on Chris because he's on my screen, if I give Chris as the plan sponsor $1,000 in his healthcare spending account, and he uses 600 of those dollars, if I choose the balanced carry forward option, that $400 unused balance in this example would be carried forward into the next benefit year. So Chris would have $1,400 to spend in year 2. Simple as that. It's a balanced carry forward option. And again, these options have to be chosen annually in advance. The other option that an employer can choose is what's called an expense carry forward option. So for example, using Chris, picking on him, I give him $1,000, and let's just say that one of his kids needs orthodontia, or Chris needs orthodontia. Chris has an orthodontia expense, and that orthodontia expense is $5,000. Chris could submit that expense. He would be reimbursed to the balance of his healthcare spending account, in this case, $1,000. And then next year, another $1,000 is deposited into his account. So he could use his 2023 unused portion of that expense to claim in 2024 on his healthcare spending account. And the other option is no balance carry forward option, or no carry forward option at all. It's use it or lose it, as simple as that. But the benefit promise, it's important to understand within the healthcare spending account, the benefit promise has to be made annually in advance. And the plan sponsor determines the formula or amount that goes into the healthcare spending account. And again, they've got to choose one of these three options. These rules are not set out by the Benefits Trust. These rules are set out by our friends at Revenue Canada.
Robert, I have a question while you're on the options.
Yeah.
What happens is employer says, I want to have 2 classes. I want to have administration to be class A and the balance of factory workers in the class B. Can you do that?
Absolutely. You can absolutely do that. Well, as I was mentioning, you could do this by class. You could have a company that has $1,000 for management and $500 for staff, for example, and the management has a balance carry forward option and the staff has no carry forward option. So you can mix and match depending on classes, and we're going to share some of that with you in some of the case studies that we do further on in the presentation today.
Thank you.
So risk analysis continue, where and when do you use a healthcare spending account? Well, it's important to understand the client's compensation philosophy. It's important to understand their benefit philosophy. And I think also as a professional advisor, it's important to understand the group demographics. You've got to take all of that into consideration, I think, when advising an end user client, when you're advising your client on how to use a healthcare spending account, or if a healthcare spending account is even important as part of their benefit promise. So understanding compensation philosophy, benefit philosophy, and understanding their group's demographics. And let me explain why. Understanding compensation philosophy. It's interesting. A lot of companies, I would suggest that all companies have a compensation philosophy. I would suggest that every single company has a compensation philosophy. It may not be written down. It may not be in a policy manual. It may be just in the business owner's head, but every company has a compensation philosophy. So I think the main thing you got to do is you got to ask the question, what is your compensation philosophy? Do you want to be the top payer in your industry? Do you want to be the lowest payer in your industry? Do you want to be a competitive payer in your industry? For these people, your senior management team, do you want to be the top payer? For your office folks, do you want to be an average payer? It depends on what their philosophy is. Also, their compensation philosophy is especially since 2020 are people working from home? What about people that were working in an office downtown? Are they working there part-time? Are they working at home part-time? Are they working in a plant or manufacturing facility? My future daughter-in-law is a physiotherapist. She can't work from home, right? In the traditional sense, she really can't work from home. The other thing is, what industry is the client in? What type of talent do they have to have? What skill set, training, special licenses, etc. You look at the HVAC industry, and I've talked about the HVAC industry for 25 years now in these presentations, but the HVAC industry is something that's amazing. Because you think about it, I live in Huntsville, Ontario. Chris, where are you now? Where are you right now?
In Toronto.
You're in Toronto. So
if I have a problem,
Yeah, so if I have a problem with my furnace or air conditioner, I'm calling somebody from Huntsville. I'm not calling someone from Toronto. Someone from Toronto is not going to drive all the way up to Huntsville to look at my air conditioner, right? Just like, Chris, if you have a problem with your pool heater, somebody from Huntsville is not coming all the way down to downtown Toronto to look at your pool heater. So it's a very localized type of business, but that localized type of business, the employees that work there, the technicians that work there are very, very highly skilled. They're licensed, they're gas fitters, they're in high demand. They're in high demand. And they're making, you know, 100 on average over $100,000 a year. So you might have an HVAC company with 10 employees where 8 of them are making over 100 grand a year. That's important to understand, as opposed to just saying one size fits all. So it's important to understand all of these different components of the company and what their compensation philosophy is around those different components. Understanding benefit philosophies. That's also important as well. Is it parallel to the compensation philosophy? Sometimes yes, sometimes no. You know, as I wrote down here, we take care of you versus empowerment mindset. So for example, I know I've worked with a lot, or not a lot, but a number over the years of community-based services, you know, community living type of services. They don't pay their people very well. They really don't pay their people very well in the grand scheme of things. But their benefits are often very, very rich. Their benefits are very rich because they can't pay their people well from a compensation perspective, but as part of that compensation, their benefit philosophy is to have great benefits. Other companies I've walked into, they pay their people extraordinarily well. Like they're ridiculous what they pay their people, but their philosophy is, you know what, go out and buy your own benefits, or we're going to provide you with the bare minimum. Really, this is a personal decision, and we've given you enough money to empower you to make your own decisions. So it really depends on what their benefit philosophy is in relation to their compensation philosophy. Their pay structure is important, whether it's hourly salary, commission, whether, you know, it's commission or bonus, performance-based compensation, whether there's the union involved. All of these things are important when discussing benefits, and certainly when discussing healthcare spending accounts. Another component is understanding demographics. You know, understanding demographics. There's a number of different factors when we're understanding demographics. It's of course single, you know, how many people are single, how many people are family, you know, what their age are, education, gender, geographic location. I know Chris works, and I'm just picking on you, Chris, because you're right there on my screen. I can see you.
Go for it, Rob.
But I know, Chris, you work a lot in the tech industry.
Right.
You work a lot in the tech industry. And I'm willing to bet the average age of your groups is probably considerably younger than the average age of somebody that works in, you know, an accounting position, right? For example.
Many of them average, pardon me, many of them average to be 31, 32 years of age across, you know, 20, 30, 50 employees.
Yeah, so 30, 31 years of age. The average age of a group in Canada is about 42. So that's 10 years less than the average.
I've had founders of companies who raised money. I had one guy raised $1.5 million he was just past 19, and one client, she raised $3.5 million on her 23rd birthday.
There you go. So their demographics, you know, a traditional plan may not make a lot of sense in those types of things, but those are important things to understand, as opposed to, again, that one size fits all. Talent competition, and I'm not talking necessarily talent competition like, hey, great, you know, all high-tech people. There's talent competition, for example, and I use the Disney McDonald's example. I was years ago, I was down in Orlando at a conference, and I remember my wife and I spent a couple of extra days. We rented a car, we were driving around. We wanted a quick breakfast. We went to a McDonald's drive-through, and an Egg McMuffin was about $8, like where other places in Florida it was about $3. But it was considerably more, materially more money. And I remember talking to a friend of mine that was an executive of McDonald's here in Canada. I said, geez, why is the McDonald's in Orlando so expensive? And he said, because we're competing against Disney. We're competing against Disney. Disney has, you know, Disney with 60,000 employees there has to pay their people $20 an hour or $25 an hour, right? Where McDonald's, in order to get employees, we have to pay them that $20 an hour. So it really depends on the geographic location, talent competition. And the other thing to note, and we're going to talk about this in one of the case studies, is remember, healthcare spending accounts are always last payers. So traditional plans paid first, healthcare spending accounts are always the last payer in a benefit plan. So The answer is, or the question is, where and when do you use a healthcare spending account? Depends. There isn't there isn't an answer. It's not for you to determine. It's really for the client to choose if it makes sense in their organization based on discussions you have around those parameters, whether it's their compensation philosophy, their benefit philosophy, and the demographics of their group. Some may make sense, some may not make sense. It really just depends. So healthcare spending accounts, when I was talking earlier in one of those slides about formulas, right? The question is, how do you design a healthcare spending account? Well, you can design it in a number of ways. You can design a flat benefit. Everybody gets $1,000, like we were talking about earlier in that example that I was using with Chris. Everybody gets $1,000 in their healthcare spending account. You can set it up as a percentage of earnings. Great, everybody gets, for example, 3% of their January 1st earnings into a healthcare spending account. Simple as that. You can set it up based on years of service. Everybody gets $200 per year of service in their healthcare spending account. So new employees are getting $200, and people that have been there 10 years are getting, $2,000. Right. So you can base it on years of service. You can base it on class. That question earlier, you can base it on class. All management get this, all employees get that, all part-time employees get this, all seasonal employees get that. You can base it on any combination of those things. It's entirely up to you. But one thing that I've found, which is interesting, is the more unique you make it, the company, it's set up for them based on what their requirements are. But the more unique you make it, the more difficult it is to replace. So we've got a client where we've been dealing with these folks for years, and we've set it up that their healthcare spending account is part of their compensation. It's 3% of their January 1st earnings that goes into a healthcare spending account, in addition to pooled benefits and a base drug plan and so on. But 3% of their January 1st earnings. So every year we've got, a data dump with 60 or 65 or 70 or however many people are in the plan, what their January 1st earnings are going to be. And then that's what their healthcare spending account amount is. So it's entered into our system. I remember a new CFO came into the business and wanted to check all suppliers, and he engaged a couple of other folks in trying to replace us and have another supplier come in just to look for a competitive bid, and nobody would touch it. All the insurance companies would look at this and go, yeah, we can't do that. But they certainly couldn't do it then, or they wouldn't do it for 60 people. And again, back to you do it in a unique way that makes sense in the client's, as part of the client's benefit and compensation philosophies, and taking into account their demographics. But the more unique you make it to that particular client, the more difficult it is for somebody to walk in and replace you. So again, healthcare spending accounts, flat benefit, percentage of earnings, years of service, by class, combination of all of the above, entirely up to the client to make the end user decision. But you can advise them and stick handle them in a way so they're coming up with that solution. Tax considerations of healthcare spending accounts. Simple. Contributions, tax, admin, and taxes made by the plan sponsors are 100% tax deductible business expenses. Reimbursement received by a plan member are 100% tax-free. Let me repeat that. Contributions, admin, and taxes made by the plan sponsor are 100% tax deductible business expenses. Reimbursement received by a plan member are 100% tax-free. It's very simple, very straightforward. Healthcare spending account contributions need to be made by the plan sponsor. They need to be made by the plan sponsor, because if not, they're using after-tax dollars, the employees' after-tax dollars to put it, and then they're paying additional tax and additional administration costs on it. It doesn't make any sense. You want to use 100% employer contributions. They're tax-deductible business expense. The benefits received by a plan member are tax-free. Tax consideration of wellness accounts. We've had a number of discussions over the last couple of years on wellness accounts. They're becoming more and more popular. We have not sold one. Okay. We have not sold one wellness account. Matter of fact, we talk people out of it. And this is the reason why. Contributions, admin, and taxes made by the plan sponsor are 100% tax deductible business expenses, the same as a traditional healthcare spending account. A wellness account, reimbursements received by the plan member are 100% taxable. It's income. It's income to the employee. A wellness account is an account of money, an amount of money a bucket of money that you would give an employee that they can use for wellness activities. And the client decides what a wellness activity could be. It could be used for anything to do with health and fitness. Great. So I'm going to go get my golf clubs regripped. That could be an eligible expense. I'm getting my bike tuned up. That could be an eligible expense. I'm paying for my monthly gym membership. That can be an eligible expense. But it's eligible as a tax-deductible business expense to the owner of the business or the business. But the reimbursement, if I get $1,000 to get my golf clubs regripped, that's after-tax money. That's just added directly to my income. So why would a company not want to do this? Well, they're going to pay additional admin and taxes, and the employee is going to get taxed on it. So it's almost like triple tax when you think about it. So it doesn't make a lot of sense. Wellness accounts don't make an awful lot of sense in smaller businesses, in my opinion. Again, lots of conversations, but once the client sort of follows the bouncing ball, we have not sold one of those accounts and done so on purpose. So on that note, why are healthcare spending accounts becoming more popular? Well, a couple of things. Number one, the way that we are operating healthcare spending account, it's an annual benefit versus an earned benefit or as earned benefit. So an annual benefit. So in other words, if I'm making an employee or a group of employees a promise that they are going to get $1,000 in their healthcare spending, or let's use another example, $1,200 in their healthcare spending account. The math is easier this way. I'm going to give them $1,200 in a healthcare spending account. And let's just say the benefit year is January 1st to December 31st. Fantastic. Fantastic. So the healthcare spending account, $1,200, January 1st to December 31st. The plan sponsor is going to put in $100 a month to fund that healthcare spending account, right? And the employee is going to be able to spend that $1,200. So on January 1st, the client puts in $100. On January 3rd, the employee goes out and buys some new glasses, goes to the dentist, whatever the expense is, they submit that expense, and we are reimbursing that expense up to that $1,200 max, even though the client has only put in $100. But we know the next month another $100 is coming in, another $100 is coming in, another $100 is coming in, etc. Versus an as-earned benefit. As-earned benefits are a pain in the ass. They're not even valued as a really great benefit plan, because if you put in $100 on January 1st and the employee's only got $100 to spend, right, and they have a $500 expense, what do? Put it in every single month and get $100 back, $100 back, $100 back until that expense is exhausted? Or do they wait 5 months and forget about it and forget to submit it, and then it's really not a value? So healthcare spending accounts are certainly becoming more popular because of how we're viewing it as an annual benefit. We do an annual reconciliation, we send an annual reconciliation report to the employer that says, great, this person spent this much, this person left and had this balance in their account, whether it be positive or negative. So the risk is, if an employee, using that example, has a $1,200 healthcare spending account, they get reimbursed that whole $1,200 and then leave the company after a month or two in that benefit year, they would have a deficit in their account, and the employer would be responsible for funding that deficit. The same is true in a traditional plan. How many times has an employee decided that they're going to leave, and just before they leave, they take all the kids to the dentist, they get some new glasses, and they top up their prescription drugs, and then they leave? Well, that shows up on the experience, and they're funding it next year. So we do an annual reconciliation report. Balance checker is important. Most suppliers have certainly a balance checking option. We have it right on our app, so you can check your balance at any time. Whether coordination of benefits is an automatic option or not, it certainly can be. It depends on the provider. It certainly works with us. The other thing we get a lot of questions on, especially from employers, is can you unused balances, for example, if you're using a carry forward option, because you can only carry forward it 1 year, can you put that into an RSP? And the answer is no, and the answer is yes, or yes, and the answer is no. So how do you do it? So it becomes a combination of a number of factors, whether you choose a no carry, whatever option you choose, no carry forward option, whatever it is. If it's not used, can that unused balance be used to fund an employee's RSP? And the answer is yes, but there are certain things that have to happen. It can't come directly from the Benefits Trust or Canada Life or Empire Life. it's got to go back to the employer as a refund. And that comes back as income to them. And then what happens is our job is done at that point. Canada Life's job is done at that point. Empire Life's job is done at that point. Then what happens is the employer has a policy, a corporate policy that says, hey, if you have any unused balance, we will deposit that unused balance into an RSP. So again, that's a corporate decision, a corporate policy. So it goes back to the company, and then the company then directs that amount of balance that is refunded into an individual's RSP. So it can be done. There's just a couple of steps involved in doing it. So it's interesting because sometimes you get the question, and a lot of people's answers are just no right out of the gate because it can't be done. But the answer is yes, it can be done, but there are steps involved. So healthcare, I can't even talk. Healthcare spending accounts are becoming more and more popular because of all of these things. It's simple now. But in addition to that, and I think the real reason is it provides budget certainty for the plan sponsor. That's the main thing. It provides budget certainty for the plan sponsor. I have looked at costs of benefits over the last 30 years, and they've gone up quicker than rates of inflation, without a doubt. You know, and plan sponsors have a line in the sand. They're saying, this is all we can spend on benefits. What's the best way to spend that money? How can we get the most value for that money? Healthcare spending accounts, as part of an employee benefit plan, provide a certain level of cost certainty. You know, it's a defined contribution plan. It provides that cost certainty for the plan sponsor. So plan sponsors really are celebrating that fact. You know, they're looking at this and they're going, this is great. I want to be in more control. Employees are loving it because of that 80-20-20-80 rule. Because a lot of employees have more empowerment. They're involved in the decision. They're involved in how they're going to spend their money. You know, Michael Lynx is going to spend his money differently than Chris Gorey is going to spend his money differently than Carrie Lane is going to spend her money, and Mike Ignatz is going to spend his money. You're making that decision based on what your family's needs are. Right? You're making that decision based on what your specific, the employee's specific needs are. It's as simple as that. So there's a lot of employee empowerment. Employers love to give employees, or certain employees, certainly empowerment, and this makes them part of the equation. The other thing is, the other reason why healthcare spending accounts are becoming more and more popular is because clients are really understanding, and advisors are certainly understanding and communicating with clients that that healthcare spending accounts are just part of an employee benefit program. It's not either or, like I said right out of the top. It's still, advisors are thinking that. All right, it's either or. No, it's part of an employee benefit program. So as I like to say, when we look at this particular slide, we've got a traditional plan on the left side of the slide, and that's a defined benefit plan. All of the benefits are clearly defined. You get, 80% of your drugs to a maximum of $5,000, for example. You get $300 per practitioner at 80% reimbursement for paramedical services. You get vision care of $150 every 24 months. Those are traditional plans. The benefit is very clearly defined. The insurer is in control because they tell the employer through you, the advisor, on what that plan is going to cost. But really, the insurer sets the rates. And if we look at the other end of the spectrum, a healthcare spending account is really a defined contribution plan. The employer is in complete control and says, great, I've got 10 employees and I'm going to give everybody $1,000 in a healthcare spending account. Therefore, my benefit cost is $10,000. Yes, plus administration and taxes and so on, right? But it's $10,000. I'm in complete control over that spend. The only way that money is going to, the only way that is going to increase is if A, I hire new employees, or B, I change the amount from $1,000 a person to $1,100 a person. That's the only way it's going to change. So complete employer control. What a lot of companies, and why healthcare spending accounts are becoming more popular, is there's certain employers are certainly starting to understand that hybrid plans are available, and they can take some of the best of both defined benefit and defined contribution, and they can make healthcare spending accounts part of their plan, and they get to choose the spot that they are on, choose the spot on the line. So they can have a lot of it with that budget certainty. They can have some of it with that budget certainty, or a little bit with that budget certainty. It's entirely up to the plan sponsor. So let me stop talking about this conceptual stuff, and let's share a couple of case studies that we do. And I call this one the 80-20 rule. And this is, this one's pretty standard. It's a pretty standard, this particular case, it's a very standard plan design, very traditional type of plan design. They got a fairly hefty increase at renewal. The renewal was certainly justified. But one thing that was clear in the renewal and in the document that the client received from the advisor is several employees were making use of their paramedicals, right? Several employees were making a lot of use of their paramedicals, a lot of massage, a lot of physiotherapy, etc., which is fine. But they did some digging, and there was one particular employee that was maxing out on multiple disciplines, and all family members were maxing out on multiple disciplines. I've certainly seen this, and I know you've all seen this as well, where you got one person that is, every kid needs 3 pairs of support hose, right? It's kind of crazy. So this jumped off the page. They were all quote unquote legit as far as the insurance company could see, but it just left a bad taste in the client's mouth. It left a bad taste in the client's mouth. So it was interesting. It created a conversation. That renewal report created a conversation, and it created a conversation. And the solution that came out of that conversation is a hybrid core company plan, which was 100% employer funded. And it was 1 times life and AD&D for the life insurance. They had the same long-term disability program, 66 2/3, pretty standard long-term disability program. They had an employee assistance program that was important to them. That was something that was new. They still have the 60 days of out-of-country emergency travel coverage with travel assist, again, pretty standard. But they changed their traditional employee benefit plan to just an 80% drug-only plan. So they still had the card, have an 80% drug plan, and then they changed their dental coverage to just 80% basic dental coverage. And then what they did is they added a new healthcare spending account, and new hires get $1,000 in their healthcare spending account, and employees with more than 5 years of service get $2,000 in their healthcare spending account. So they said, great, we've got a couple of employees that are here for a while, or been here for a while, and we want to give them $2,000, but new hires get $1,000 in their healthcare spending account. So that's what they changed their plan to. This created, the result was plan stability, more plan stability for the plan sponsor. Employee empowerment, pardon me, employee, not retirement, employee empowerment and choice. And it also, it was really interesting because a lot of the employees love the new plan, because I remember talking to the advisor about it afterwards, because he's pretty close with this particular business owner. And they were pretty certain on who this particular employee was that was using, the 3 pairs of support hose for each person. They weren't 100% sure, but they were pretty sure. And it was interesting because I said, geez, using the 80-20 rule, where 80% of the population is getting an increase in value, an increase in benefits, and 20% are getting, going to be pissed off because they get a reduction in their benefit. I asked the person, how does everyone like that new plan, and how was that one particular person? What was their reaction? And the business owner apparently said to the advisor, who told me, he was loudly quiet, quote unquote. He got caught, right? And it was changed because of him. But you know what? 80% of the people certainly loved it. But more importantly than all of this is the plan sponsor was grateful for the advisor's recommendations. Plan sponsor was incredibly grateful for the employees or the advisor's recommendations. Case study number 2. I call this one when a plan starts feeling like charitable giving. This is a life advisor who dabbles, quote unquote, dabbles in benefits. And this was a shop owner, 10 employees. The owner offhandedly mentioned to his life advisor that a bunch of staff in the shop already have benefits through their spouses, right? He goes, he wants to put something in place for the others, and it worked out that there was, looking at demographics, 6 out of 10 of them have spousal coverage. So he wanted to put something in for the other 4. You kind of can't do that. The advisor was smart enough to know that you can't do that. But putting in a traditional style plan would mean they would be the primary coverage. He would be the primary coverage, or it would be the primary coverage for those 6 employees, plus some of their children, plus the 4 employees. And then they joked that the other companies that their spouses work for might want to send them a thank you card for taking all these expenses off their plan. They did not want to do this. Right? It was as simple as that. He did not, the business owner did not want to do this. But again, the client understood what their compensation philosophy was. He understood what their benefit philosophy was by asking questions, and understood where they were going and the future of their business. One thing that is unique about this business is it's a highly profitable business. It's a real family feel. The owner really wanted to take care of all of the employees, but he didn't want to, have the expense of taking it over from other people that are already paying. He's got some long service employees, and there was no plan in place. So the solution came down to, I call it groups within the group. So all employees got 25,000 of life. All employees got 25,000 of AD&D. His philosophy was, if they walk across the road to Tim Hortons to get a coffee at break time or lunchtime or whatever it was, if they got hit by a cement truck, he wanted to be able to deliver a check. Right. So 25,000 of life in AD&D. They put in TELUS virtual healthcare, which was important to them. They put in the 60-day out-of-country emergency travel coverage and travel assist. For the owner class, even though he didn't think he had a lot of expenses, they put in 100% unlimited health and dental coverage. No maximums, no co-insurances, no deductibles. Just all of the expenses would be reimbursed through the plan. Don't know what the costs are, don't care, right? And for each full-time employee, gave him $2,000 healthcare spending account. Right, so everybody was treated equal. Right, every employee got a $2,000, in this case, healthcare spending account, flat benefit, right? Fine, no problem. That was the plan he wanted to put in place. It was great. The result was, by putting the healthcare spending accounts, this plan was the last payer. As we discussed, the healthcare spending account is the last payer. So the 6 that already had benefits were still submitting to their spouse's plan any unused amounts, so then they could use their healthcare spending account. The employees that didn't have benefits now have a $2,000 healthcare spending account that they can use for whatever they want. The owner wasn't initially looking for benefits. He didn't think he had a lot of expenses, but once the advisor convinced him to put in that 100% plan, because the advisor convinced him to put in the 100% plan, because any expenses that he did have for things like glasses or anything along those lines, they would be, instead of paying for with after-tax dollars, they would be paying for them with tax-deductible dollars, as we all know. Well, after initially claiming they didn't have enough expenses to make it through, to make it worthwhile, all of a sudden, the family claimed roughly $5,000 in the first year. What happened was the spouse got a hold of this, and she bought new glasses with every outfit that she owns, and to match her purse and her shoes, and there was just different expenses that the spouse was unaware of, or that the business owner was unaware of. And it's amazing the things that come up, but all of a sudden they understood it, and they realized that this was a powerful way to pay for things that they were going to buy anyway. People are bad at estimating their expenses, but once they have a plan like this, they make different decisions, right? So the results of this particular case, again, everybody's taken care of in the company. They're not paying first, they're paying last in 6 of the 10 situation, and the owner's well taken care of with his benefit plan in a tax effective manner. Again, small case, what Canada's made up of. Case study number 3. Let me just flip ahead here. Case study number 3, law firm, multiple partners, professional corporations, right? Pretty common. The firm already has a traditional plan in place for all support staff and everybody other than the partners, and it's funded by the firm, right? It's funded by the firm. The partners are currently maxing out the existing plan, if the partners are currently maxing out on the existing plan, which many of them were, they have to pay for out-of-pocket medical expenses. And the partners did not want to change the existing plan with the firm. Like a lot of law firms, they have committees and they make decisions in slow and long ways, and it's confusing, and we want to have a better plan for this partner, and some of the other partners are saying this isn't fair and blah, blah, blah. It's a big pain in the neck. So the partners were not interested in changing this particular benefit plan at all. They didn't want to open up Pandora's box, committees for everything. And again, often lawyers and especially partnerships make things more difficult than they, in my opinion, than they need to be. But who am I to say? So the solution that was put in place was kind of interesting because there was a lot of partners that were complaining that they were having expenses that weren't covered through their benefit plan and they were having to pay for them with after-tax dollars. The solution was to leave the existing plan as it was with the existing advisor, set up separate healthcare spending accounts through the partners' professional corporations to supplement the existing plan, right? And so therefore all healthcare spending account amounts to cover out-of-pocket medical expenses. So there are a number of partners in this firm, and a number of partners have chosen to purchase these individual healthcare spending accounts through their professional corporations, and each partner gets to choose what they want to put in as the promise they want to essentially make for themselves, right? It's simple as that. So they've got different amounts for different partners depending on what their needs are. The result of this is fascinating, in my opinion, right? Because there was no disruption to the existing plan with the law firm. The existing advisor is still in place. The existing advisor doesn't even know that this is going on. So all of a sudden, the partners that are making the decision about the existing plan, they're looking to keep those costs down and keeping those costs, they're not looking to make any changes to that plan now that they've got this level of icing on top of things. The clients now, the partners don't have to use any personal funds to pay for their claims. They implemented these supplementary accounts, and now the healthcare spending accounts have increased in year 2 for all accounts because they're starting to really understand it. The partners are starting to really understand it, and they're using the Cleveland Clinic and MedCan, and in one case there were some out-of-country claims that were they had services that were done outside of Canada, and they were utilized their funds to pay for those expenses. But more importantly than all of this, the advisor that has put these in place is meeting with each of these individual lawyers, individual partners, and he is advising them on how much money to put into their healthcare spending accounts, and he's setting it up so it's seamless for them and it's easy. But he's all of a sudden their trusted advisor, not the advisor who has the firm's plan, who deals with the HR department. This particular individual is dealing with all the individual lawyers as their trusted advisor. This person is taking advantage of those relationships. I shouldn't say taking advantage of those relationships. That's the wrong thing to say. This individual is taking advantage of the opportunity and doing a lot of business in different areas with those particular partners because he is now their trusted advisor. So in summary, we've spent 53 minutes together now. In summary, healthcare spending accounts are part of an employee benefit program. If there's one thing that I want you to remember from today's session, is healthcare spending accounts are part of an employee benefit plan. I had a conversation just this week, or last week, pardon me, with an advisor, and he thought it was either or. No, healthcare spending account is part of an employee benefit program. Plan sponsor determines how big that part is going to be. The 80-20 rule, 80% of the population gets a benefit improvement, 20% of the population gets pissed off. Another way to look at it, 20% of the population is driving 80% of the costs of a traditional plan. Guess what? I'd like to simplify things so plan sponsors understand it, your prospects, your clients understand it, you get their head nodding. No one can argue with that. People get it. They understand it. It makes sense. Yeah, 20% of the population is driving 80% of the cost. It might be a different 20% every year, but it's still driving 80% of the cost. 80% of the population with a healthcare spending account or a component of a healthcare spending account are going to get a plan improvement, and 20% of the people are going to be disadvantaged. Fantastic. Often that disadvantage is coming in the way of the owner of the business, and you can deal with them separately, like we showed you in case study number 2. Healthcare spending accounts provide plan sponsor cost certainty. They're tax effective. They're always the last payer. They're empowering to the employees. And you've got an endless supply of healthcare spending account design flexibility. We've got an ebook that we put together called A Smart Business Owner's Guide to a Healthcare Spending Account. Mike, when we send out the CE credits, can we make sure there's a link for that ebook?
Will do.
Thank you very much. So you'll get a link to that ebook. It's on our website as well. But let me stop sharing right now. And let me stop sharing right now. And we've got a couple of minutes to spend. And anybody have any questions, thoughts, ideas? This is where we participate. I often get comments back that say, there's not enough participation. But anyways, Drew, did you have your hand up?
Yeah, I guess I agree. First of all, great presentation, and I totally agree wholeheartedly with healthcare, with the advantages of healthcare spending accounts. I just think that one of the things,
I'm listening to
Michael, could you mute yourself, please?
Sorry.
Okay.
Sorry, what I was going to say is one of the great misnomers, or the things that plan sponsors, at least out of the gate, misinterpret, is that by carving out certain aspects of their plan, trimming it down, and then replacing some of those with a healthcare spending account, that their costs are all of a sudden going to reduce, in some cases drastically, and that's just not true. And I think that one of our obligations is to make sure that they understand that and know that this is a long-term play and not a short-term play, because the reality is, when you introduce a healthcare spending account, obviously it depends on how robust the allocation is. It's a new toy to play with, right? So year one, I think I've yet to see a situation where the costs actually haven't increased, just because, again, it's a new toy to play with. I think it's over time that things level out a bit, and obviously provide more flexibility for the employee base. So anyway,
Drew, you brought up a great point, and you brought up a great point. I was out golfing on Friday with the outgoing president of Claim Secure and the incoming president of Claim Secure, and we were chatting about that. And I said, and there was another advisor with us, and I said, why do advisors, I'm not talking about the people on this call today, but why do advisors think that their job is to provide the lowest cost solution to their clients? And these guys have been in this industry for many, many years. And they just said, because that's what most advisors think their job is, and that's the only way they can add value. And Drew, you brought up a great point. This isn't necessarily about saving costs. It's about potentially controlling costs over a long term and providing the right benefits for the right people at the right times.
Well, and I think just to add to that, and I know everybody's probably experienced this with their clients, so it's probably not a lightning bolt of information. But I had someone the other day said to me, well, why don't we cut out elastic stockings and hearing aids and everything else, and that should reduce our health rate as well. I'm kind of going, so you're asking the insurance companies to reduce your rates on something that's not getting used. Not going to happen, right?
All right.
So
Simon, you've been walking through this entire presentation. You got your hand up. Oh, you stopped walking. I don't want you to interrupt your walking there.
We can walk.
Walk and talk. How many kilometers have you walked during this presentation?
It says basically 5 miles per hour.
Good for you. So 5 miles. There you go. Well done. Simon, what's your question?
In your presentation, you talked about 100% coverage as opposed to 80% coverage, and I have my reasons for suggesting 80%, but I wanted to hear your thoughts in terms of.
So what using that example, thanks, Simon. Using that example, it was just for the employee, the business owner class, the executive class, for 100% reimbursement. So the example I used, my glasses. My glasses cost me $600 a pair, right? I went and got these glasses. They look good on me. They make me look like Brad Pitt, so I look like a superstar. And I said to the person that was helping me out at the optometrist's office when I got these glasses, she helped me choose them. She said I looked hot, smoking hot. And I said, great, I want 3 pair. I want 3 pair because I want 1 pair for my office here. I want 1 pair for my briefcase and 1 pair for my office at my office. And she goes, that's going to be $1,800. I said, fantastic. Then I submitted that through my benefit plan. I got reimbursed $1,800. No limits, no co-insurances, no maximums, no deductibles. right? So my business just paid for the glasses that I was going to buy anyway, at $1,800 versus me having to pay for those $1,800 out of my pocket, which was I going to buy anyway, right? I was going to buy those anyway because I'm a forgetful person and I want to make my life simple. So it's just a tax effective way to pay for the things that you're going to pay for anyway. That's all it is.
So I agree with that and 100% support that. When it comes to employees, and you're talking about 80% or 100%?
Oh, when I'm talking about employees, that's really a plan sponsor decision.
I
Right.
agree, it's a sponsored decision, but how are you influencing them? What
That-
are you gonna tell them
that-
to go one way or another?
Again, you're talking about demographics, you're talking about compensation philosophies, benefit philosophies, and so on. Okay, hold on one second, guys. People, friends, everybody. It is good to see you, Andrea. Good to see you on the call. By the way, it is 11 o'clock. So we're going to end this formal part of this presentation. So I want to thank you very much. We're going to stick around for a few minutes. If you've got some other questions and you want to hear other questions, stick around, please. But again, on behalf of all of us at the Benefits Trust, Carrie, Rob, Mike, we want to thank you very much for participating today. We're going to send you a CE credit very shortly, Mike, with a link to our trusted advisor newsletter, or sorry, a link to the healthcare spending account ebook that we've written. And we're going to send you the CE credit. We're going to send you a real short survey, fill it out, get back to us. And in addition to that, we encourage you to visit thebenefitstrust.com, check out some other things that we are doing. We're coming up on our 35th or 30th anniversary next year. So we've got some exciting things in the works, that's for sure. So again, on behalf of all of us, thank you very much. And we look forward to your feedback. If we're doing business, thank you for your continued business. If we're not doing business, we'd love to, because guess what? We're not sold out. We got some more on the shelves. So thank you very much. Again, we're going to stick around. So I'm just going to stop recording. And if you got to take off, appreciate your time. Thank you very much.